Hello again, it's Jenny with StudyNurseIQ. Before we dive into the major disease processes like CAD and MI, it makes perfect sense to quickly review the foundational components of blood and the complex steps of clotting, which is officially called hemostasis. After all, blood is the central character in the cardiovascular story. We're going to go through these concepts one by one, making sure everything is crystal clear. Then, we will wrap up with a 3-question quiz to test your knowledge. When we think of blood, we often just think of the red liquid, but it's actually a complex tissue made up of two main parts, the liquid portion and the solid, or formed portion. Imagine a tube of blood that has been spun in a centrifuge. It separates neatly into layers. Plasma is the top, yellowish layer, making up about 55% of the total blood volume. Plasma is mostly water, but it's packed with essential substances that keep the body functioning. Formed elements are the heavier cells that settle at the bottom, making up about 45% of the total blood volume. Let's look closer at what's floating around in that plasma. Since the plasma is about 90% water, it acts as the perfect solvent, allowing substances to dissolve and move throughout the body. The ions like sodium, potassium, and chloride are critical for maintaining fluid balance and nerve function. Proteins are the workhorses of the plasma. We need to remember 3 key types. Albumin is huge for maintaining osmotic pressure. Think of it as a sponge that keeps fluid inside the blood vessels. Globulin includes the antibodies that fight infection, which are a core part of the immune system. Fibrinogen and clotting factors are the essential inactive ingredients needed for blood clotting. We'll talk a lot more about them in a minute. Plasma also transports nutrients like glucose and fatty acids, waste products like urea, and gases like dissolved oxygen and carbon dioxide. Now we move to the solid, cellular components that do the heavy lifting in terms of oxygen transport and defense. Red blood cells, or erythrocytes, are little discs primarily responsible for 2 things: carrying oxygen from the lungs to the tissues and removing carbon dioxide from the tissues back to the lungs. Think of them as the delivery trucks of the body. White blood cells, or leukocytes, are your body's personal army. They are a core part of the immune system, detecting and fighting off pathogens, bacteria, viruses, and foreign invaders. When your white blood cell count is high, it usually means your body is fighting a battle. Platelets, or thrombocytes, are not technically full cells, but fragments. They are the first responders in the clotting process, the tiny, sticky pieces that rush to the site of an injury. Now that we've talked about platelets and their role in clotting, let's move into hemostasis, the process that actually stops bleeding. Hemostasis is the complex process that prevents you from bleeding out when you get a cut. It's the body's natural defense mechanism against blood loss, and it happens in a couple of steps. This process is generally divided into 2 main phases that happen rapidly one after the other. Primary hemostasis is the fast initial response. As soon as an injury occurs, the blood vessel quickly tightens up, or vasoconstricts, to reduce blood flow through the damaged area. This is called vascular spasm. The platelets rush to the damaged site, become sticky, and start clumping together in a process called platelet aggregation. This aggregation forms a temporary, unstable plug that seals the hole. Think of this as putting your finger over a leak. It slows the bleeding, but it won't hold forever. Secondary hemostasis, also known as the coagulation cascade, is the much slower, more robust phase that involves the plasma's clotting factors to create a permanent seal. The formation of the platelet plug triggers this secondary phase. This is where all those clotting factors we mentioned in the plasma come into play. They engage in a complex chain reaction called the coagulation cascade. We divide this cascade into 3 pathways, which are critical for understanding how blood-thinning medications work. While you don't need to memorize factors 1 through 13, you do need to know how we measure these 2 main pathways. The intrinsic pathway is activated by damage inside the blood vessel, such as when blood comes into contact with the exposed collagen of the vessel wall. We measure the efficiency of this pathway using the APTT, or activated partial thromboplastin time. This is a test we use to monitor people on heparin therapy. The extrinsic pathway is activated by trauma outside the blood vessel, such as a physical wound that damages tissue outside the blood. We measure this pathway using the PT, or prothrombin time, often reported as the INR, or International Normalized Ratio. This is the key test we use to monitor people on warfarin, also known as Coumadin therapy. Both the intrinsic and extrinsic pathways meet up in the common pathway to complete the final essential step. Prothrombin is activated into thrombin. Thrombin then activates fibrinogen, which is soluble, meaning it floats in the plasma, into fibrin, which is insoluble, or solid. The fibrin threads form a stable mesh-like network that reinforces the temporary platelet plug, creating a strong, permanent clot that stops the bleeding completely. To summarize everything we've just covered about hemostasis, remember this one crucial concept. Hemostasis requires both platelets and clotting factors. When we talk about coagulation disorders later, you'll see that some disorders, like thrombocytopenia, are caused by a lack of platelets, and other disorders, like hemophilia, are caused by a lack of clotting factors. You need both components working properly to stop bleeding. You've learned a lot about blood composition and how clotting works behind the scenes. Now let's put that knowledge to the test with 3 NCLEX-style questions. Question 1. A nurse is reviewing a client's lab results and notes an elevated PT or prothrombin time. The nurse recognizes that this result measures the efficiency of which clotting mechanism? A. Primary hemostasis, platelet plug formation. B. Secondary hemostasis, specifically the intrinsic pathway. C. Secondary hemostasis, specifically the extrinsic pathway. D. The breakdown of an existing fibrin clot. The answer is C. Rationale. The PT, or prothrombin time, is the key test used to measure the efficiency of the extrinsic pathway of the coagulation cascade. This pathway is most commonly monitored in patients taking oral anticoagulants like warfarin. Question 2. A student nurse is describing the components of blood. Which substance should the student correctly identify as a formed element rather than a component of the plasma? A. Fibrinogen, B. Albumin, C. Erythrocytes, D. Water. The answer is C. Rationale. The formed elements are the cellular components of blood, which include red blood cells or erythrocytes, white blood cells or leukocytes, and platelets or thrombocytes. Fibrinogen, albumin, and water are all components of the liquid plasma. Question 3. Formation of the permanent stable fibrin clot occurs during which phase of hemostasis, and what key element is responsible for strengthening the plug? A. Primary hemostasis, platelet aggregation. B. Secondary hemostasis, vasoconstriction. C. Primary hemostasis, fibrinogen. D. Secondary hemostasis, fibrin. The answer is D. Rationale. The transition of soluble fibrinogen into insoluble, thread-like fibrin occurs during secondary hemostasis, the coagulation cascade. Fibrin is what reinforces the temporary platelet plug to form the stable final clot. Excellent work! You now have a solid foundation in the A and P of the hematologic system, the primary components of blood, and the steps involved in hemostasis. Understanding that balance between too much clotting and too little clotting is vital for almost every cardiovascular concept we'll discuss next. Speaking of next, we are now ready to pivot to the major disease processes. We will cover coronary artery disease, or CAD, and the difference between angina and a myocardial infarction, or MI. This is high-yield nursing content, so get ready. Let me know if you are ready to jump right into CAD. If this teaching was valuable to you, please hit subscribe on YouTube and join our community here on StudyNurseIQ, where we make nursing simple.